From the nonpartisan Maddy Institute and the California channel at the state capitol, this is a Maddy Policy Brief. Welcome back. We're talking with the state auditor, Elaine Howell, about a recent report her office issued on the over-medication of children in the state's foster care system. So let's get right to the bottom line. Is there a problem with the way psychotropic medicines are being prescribed and monitored in foster care?
Absolutely. We looked at statewide data, but we also went and visited 4 counties, and what we found consistently is that children are receiving more medications than they should for their age. The dosages are in excess of what the maximum dosage should be, and in some cases they're receiving multiple medications within the same drug class, which again the state guidance says you should not do. So across the board we found problems at all 4 counties.
And I would assume then there are short-term effects and there are long-term effects, consequences of this. So the short-term effects would be, you know, it does calm volatile moods, right? If they're excitable, this helps calm them down, but I assume there are some side effects.
These are very, very strong medications like you were referring to, antipsychotics, stimulants, antidepressants. And the side effects are weight gain, weight loss, fatigue, sleep disturbance, pain. So very significant, very significant side effects.
And I assume also then there are long-term side effects as well.
There certainly could be with respect to these types of medications, particularly if a child is not being monitored or being seen by a prescribing physician.
Yeah, you don't know what effect that drug is really having on it. You just prescribe it and kind of walk away. So you actually looked at 80 cases. You examined 80 cases. Mm-hmm. How often did you find that the amounts of the drugs and the dosages of the drugs given to foster children were beyond state guidelines, exceeded state guidelines?
So we did visit 4 counties, Los Angeles, Madera, Riverside, and Sonoma.
Very different counties, by the way.
Yeah,
I mean,
we wanted to get
to,
rural, you know, obviously
urban,
LA, a huge county, and get a cross-section of the state of California. And as far as excess dosages, 23%, so about 12 kids that we looked at out of the 80 cases were receiving excess
about a quarter
dosages.
Of the kids.
Right, pretty close to 25% of those.
It seems like for some people it might be a simple way to
Mm-hmm.
handle a problem child to just give more medicine and kind of make them a zombie, essentially. And that's dangerous on many levels.
It's certainly a concern that not only you know, the state of California should have, but the social workers, the probation officers, et cetera, the caregivers for this particular child should be well aware and be monitoring, doing a better job of monitoring.
And a similar number you had 14% of the cases you studied, the kids were given multiple psychotropic medicines in the same drug class.
That's correct.
Double dosing.
Right. So all 3 of those conditions that I identified earlier, we saw problems at all of the counties. And the percentages, like you said, 14% for the multiple classes. As far as the age, it was about 11%, and we just talked about 25% getting, you know, excessive dosages of medications.
So it seems like a problem of oversight here. Is it the county's responsibility?
I think the responsibility is across the board. Certainly at the county level, there should be more oversight and more direct monitoring of the children and the medications they're being prescribed. But you have the medical board that should be paying attention to the physicians who are prescribing the medications, and certainly the state agencies, social services and healthcare services have a role as well.
Well, let me ask you though about the county. Let's kind of focus on that for a second. There's supposed to be sometimes court authorization for this, right, for medicines. There's also could be parental consent. In your report, though, you found that a substantial percentage are not getting court authorization before they give these medicines or parental consent.
Absolutely. That was a major concern for us, that there is a process. It needs to go through the court. It needs to be authorized by the court that this child needs this medication and what the prescription should be. Also, what you're looking for in court records is what kind of mental health services, called psychosocial services, behavioral services, are these children receiving in conjunction with the medication. That's critically important, and we didn't see that happening.
It's interesting, the numbers in your report, about a third, 30, I'm not going to get too specific on the numbers, it's about a third of the situations they don't get court authorization or parental consent.
Right.
A third, 1 out of every 3, that's quite a bit. So state has some responsibility here. Have they dropped the ball?
I think the state of California needs to do a better job. Certainly the Department of Social Services and Healthcare Services do conduct some oversight, but what we found is, with respect to this particular issue, the prescription of psychotropic medications to children, they were not managing that, not overseeing that. So when they were going out and doing reviews, this was not part of their plan to assess how well this particular part of managing foster children and providing services to these kids.
Specifically says that these state agencies cannot completely identify which foster children are even getting these medicines.
That's true, and that's part of, I think we're going to talk about it, this fragmented system, because social services has certain information about foster kids, healthcare services has certain information about foster kids, and they're not talking to each other. So there's no comprehensive place to see all the medications a child's receiving, what types of services, et cetera. It's very fragmented.
I want to ask you also about, you mentioned these psychosocial services, follow-up visits. That's also a problem too. They don't know, either it's not happening or they're not monitoring what is happening in that regard, correct?
That's correct. And looking at, again, when we looked at the 80 case files, we were actually looking at paper files, looking to see what kind of medications are these children on. Comparing it to the database, there might be information in their personal file called their health and education passport for a child. Looking in the database, well, that medication's not recorded in the database, or a mental health services or a follow-up visit is supposed to be happening. It's not being tracked in that electronic database.
For a more in-depth analysis of this and other public policy issues important to Californians, please log on to our website at maddyinstitute.org and click on the Policy Analysis tab.